I choose to practice more Oriental medicine, or should I say medicine with a more Oriental flair, simply because it's something that suits my own sense of rightness. I had studied acupuncture and Oriental medicine in general under many different teachers. I also completed the course through the University of California for physicians to train physicians in what they called medical acupuncture. It's still the same thing, but the one thing is that it offered many different views. You know, it's not just a Chinese perspective, it's not just a Japanese perspective, it's also the way that acupuncture is practiced in France or in Italy or in Europe. It's different only in you know, the concepts that people use in treatment. I mean, the laws of acupuncture remain the same. The laws that have to do with what disease, how does disease manifest in the body, and then how do you approach it, you know, in terms of treatment. You know, I mean, all my Western training is not lost on me. It's certainly not lost on my patients, because I still use all those skills that I learned, but I'm just applying them in a different way. It's very different from how Western medicine views disease. Western medicine is extremely good when you're dealing with acute emergencies, car accidents, knife wounds, gunshot wounds. Basically, you know, tries to apply what is called the scientific method. You know, so everything is minimized to its smallest atom. Whereas in acupuncture, we look at you as being the microcosm within a macrocosm. Nothing is separate. You are as much a part of the universe as the universe is a part of you. So disease can be caused by many, many different factors. Certainly Oriental medicine doesn't look at disease as being caused by bacteria or viruses. It's caused often by emotional factors, by environmental factors, certainly occupational diseases, all those kinds of things.
Do you have any kids?
Two.
How old are
Grown, 33 and 30, almost 36. This month, 36. Yeah. 2 girls.
they? Because of the high energy nature that you have, you are always going to, you know, the dog that's hunting, it just keeps going until it's completely exhausted.
A bullet wound or a bullet that is actually gone through the heart or the lung or whatever, you know, the ability to go in there and actually do surgery on it, that's not something that Oriental medicine is interested in. It's capable of dealing with those things, but it's certainly not as adept as what Western medicine is in dealing with those kinds of emergencies. In the history of Chinese medicine, they've certainly seen every kind of emergency you could possibly think of over a period of 5,000 years. You have to consider it a completely different paradigm. I mean, I think you need to look at each patient and decide which modality is best for this patient. Are we going to go straight Western medicine, or are we going to go with Chinese medicine? Most of us have developed over many years of living either disease states or you know, because of wrong eating or bad habits, have developed different problems. And this is where Chinese medicine or Oriental medicine, as far as I'm concerned, has its greatest value. Because Western medicine really has a hard time dealing with the so-called semi-chronic or chronic ailments.
But definitely the focus of all of your energy is at that area. That's really where your major blockage lies. And it definitely affects your kidneys and also your digestive tract.
Say, for instance, you have somebody with a vascular obstruction or whatever. You know, you're still going to, in acupuncture, you're going to look at it as a blood flow disorder, but you're not going to necessarily treat it in the way that Western medicine would look at it as, well, I'm sorry, you know, other than giving you things to stop your blood from clotting, we're going to need to do surgery. You know, the body is so capable of repairing itself. All healing relies on the body, not on what I'm doing to the body or what medicine I'm giving you. Thus, the inherent abilities of the body to heal itself, how are they impaired? By what are they impaired? And what can I do to enhance that healing ability of the body, rather than to either, you know, poison it with chemicals, or to do surgery. And I'm not saying that surgery is not a necessary part of medicine. I certainly am the first to say to a patient, look, I don't think there's much I can do for you. I think you need surgery. Then after you've had your surgery, come back and I will help you to recover.
So we're going to shift the energy of it here. All of the acupuncture points that are present, you know, on the body are present on the hand in microform. The way that the body appears on the brain, the homunculus, so to speak, the hands cover more area on your brain than any other body part. So it makes sense that it, you know, would be as effective as it is, just because of that connection.
It actually doesn't hurt at all.
No, it doesn't hurt.
It doesn't.
Well, I mean, it you know, you can feel there's a little sharp thing there, but
I don't. Yeah, I feel it feels like just like your thumb is pushing on my hand. Yeah, it doesn't hurt. It really doesn't hurt, Mihdi, at all.
if I used the little needles on your hand, it would hurt a lot more. Yes.
Yeah.
And this is the other reason why I like the Korean hand acupuncture, is that the changes happen within about 20 seconds after you put the needles in.
Wonderful.
No, Oriental medicine definitely looks at you in a more holistic view, where every factor that could possibly influence your body's ability to be healthy or become healthy is a consideration. Western medications, pharmaceutical drugs, all have side effects. You know, I'll just call them effects. Yes, some of it may be good. You know, yeah, I'm going to lower your blood pressure. But what is it doing to your kidneys or your liver or other parts of your body? You know, I mean, we see cases every day where a medication that was approved by the FDA is suddenly taken off the market. You know, an anti-inflammatory that's taken off the market because suddenly more people are dying from heart disease or kidney disease. Over a 5,000-year or more period of practice, of empirical practice of Chinese or Oriental medicine, you know, their understanding of how the combinations of herbs, for instance, can be applied to minimize side effects. Herbs are still chemicals, you know, I mean, whether you like to think about it or not, just as vitamins are chemicals. That's why it's important to have a physician or a practitioner that is qualified decide what dosage you need to take, because certainly herbs can make you sick. If I gave you the wrong herb, I could kill you, sure. You know, so it's not like it's completely safe. It depends on the dosages, it depends on your own sensitivities, what kind of diseases that we're treating. It's not a simple matter.
Now, I understand in China there are many who practice and learn both modalities of medicine. But at the same time, there are those who practice and learn just one or the other.
Right. I think it's very, very difficult to practice Oriental medicine with the right philosophical attitude if you're going to still give a lot of Western drugs, because they definitely are somewhat incompatible with a healthy body. Many times patients will come in and they're on multiple drugs, Western drugs. You know, say for instance somebody with high blood pressure. You can't just take them off their blood pressure medication all of a sudden. You have to maintain them on some of the medication, but being a physician helps me to understand which drugs may be absolutely necessary and which I can actually eliminate. And then as I treat the patient, gradually we will see whether we can actually reduce the dosages or finally totally eliminate a particular drug that's being given.
Right.
And I take thyroid.
How much?
Oh, let me see. I want to say 125. Does that sound right?
Are you on Synthroid or?
Yeah, Synthroid, and then another one too, the little tiny white. The other one is Balances. It's T3, maybe.
Yeah.
Yeah, it's got a long name which I don't remember, but
Yeah.
and I take the generic of both.
Okay.
Yeah.
Yeah.
I'm probably one of the least likely people to order lab work unnecessarily, because I feel that if you listen to the patient, examine the patient, frequently, you know, more frequently than not, you know what's wrong with the patient. Lab work, I feel, is very much the result of the litigious world that we live in, where doctors feel that they need to cover their asses by doing all the lab work or doing all these so-called objective tests, including CT scans and MRIs and, you know, all of the things that we're saddled with.
So what is the key? What is the fundamental element of acupuncture and Oriental medicine that makes it work?
Well, you know, it's the basic concept of qi, energy. If a human being has no qi, he dies, or he or she dies. You know, what is it that keeps us alive? We're not just chemical or mechanical beings. It's not an electrochemical reaction that made us come alive.
So this qi,
yeah.
is it just in us? It's in
all of
energy?
nature. It's everywhere. Everything in nature is qi. In fact, probably if we want to take it to a more esoteric level, everything is consciousness. There is nothing that exists that is not consciousness. And So in many ways, when I'm dealing with patients, I'm dealing with a transmission, or I'm working with different levels of consciousness.
So would you say that this is a bit far-fetched for most Western minds to?
No, I think if
Deal
you're
with?
if you're a physicist, you can understand what I'm talking about.
Explain.
Well, certainly particle physics and various subsets of the physics world recognizes that, or quantum physics in particular, recognizes that everything is energy, and that there are actually more spaces in your body than there is solid material. So what is it that keeps this body together and actually functioning as a unit? You can hear the chi of the patient by listening to them, listening to the voice, listening to the sounds they make, smelling them.
Smelling them.
Yeah, absolutely. You have to see, certain patients have, disease states have certain smells. Diabetic patients often smell sweet, almost fruity. Cancer patients have a very particular smell to them. And this is true for many disease states. Obviously, you have to make sure that your senses are heightened to be able to pick up all these things. Just as listening to the patient's voice. You're not asking them to speak in any particular way. You're just listening to their natural voice. And that tells you something. You look at the patient's face, or look at the patient's body. Do they have signs of excess or deficiency, or do they have a problem with their kidneys or their liver or digestive organs or whatever, and it's present. But you need to be trained in order to pick this up.
And your tongue definitely also indicates the excess of fire that you've had in your life. Because the tip of your tongue has got a little, like a depression in it.
Yeah.
Certainly in Western medicine, there is an emphasis on clinical diagnosis that does talk about smelling and listening and, examining the patient with all of your senses. But I feel that in the last 20, 30 years, less and less of that is being used by medical schools.
It definitely affects your kidneys and also your digestive tract. If you look at the nerves that come out of that area and the organs that they feed. It involves the pancreas, the stomach, and the adrenals. So I would very much recommend that you do some kind of gentle side-to-side motion, to free that area up more and more.
I'll just wonder what you mean.
I will.
Is this something that I should do, or?
Yeah, no, that's something you should do for yourself.
Okay.
So your body has tried to overcome it and balance the issue, and even though it's been relatively successful, as you get older, you will find that the fact that there's just an altered nerve and blood supply, it will definitely affect you. By moving your shoulders and your chest,
Yeah.
it's really this motion here that's
Okay.
important.
All right.
And even doing this kind of thing where you're, swaying from side to side, so that you're,
that'll be good too.
so you're opening up that space there,
Okay.
to get more fire and energy into your body.
Unfortunately, when you go to medical school, you get brainwashed in many ways, because you are taught that if it's not published in a peer-reviewed medical journal, then it must be junk. Then there must be no truth to it. And unfortunately, much of Oriental medicine, although you can do all kinds of research and prove that it works, it's hard to prove the existence of qi scientifically, or that there are acupuncture channels that run through the body. It's very difficult to actually image them. So when you think about it, you know, most doctors are just so busy just doing what, you know, they were trained to do, that it's not unless they have unusual curiosity that they're going to look at other systems of medicine and how they could potentially be helpful in treating their patients.
How are you seen by your, say, Western medical
My
colleagues?
medical peers, no.
Yeah.
Well, unfortunately, because they often have very little understanding of what I'm doing, and you know, they may view me with suspicion. But there are many of my colleagues who, you know, who, although they don't understand what I'm doing, become my patients. So, you know, and as they say, I don't know what you do, but what you do works. You know, yeah, it's nice and you know, neat to try and figure out the dynamics of why is it that acupuncture works. Suffice it to say that it's been working for more than 5,000 years.